So chap's invited Dr. Henry. I can't pronounce your surname, mate. What?
Or Aughterson, it's like daughter son without do.
Oh, there we go. You're a real life doctor, and I love having people who work for or with the NHS as well. And you're quite known in the men's space as well. Is that right?
Yeah, I guess kind of mental health background and social prescribing, and yeah, I've done some recent videos on kind of male mental health and masculinity stuff.
No, it's good. So I've briefly read some of your PhD stuff as well. I think it was the homeless one. I've not
Mm.
read it. I'm not going to claim I read it all, but I've got it in my bookmarks, whatever else. So kudos to you. But I love getting people actually who are on the front lines because I think when it comes down to mental health, I think like you're the guys what get the brunt of it and actually slagged off of there's no resources. It's not your fault.
Mm. Mm.
So I'm like, do you know what? Let's pull you into a chat just to get your perspective. Yet again, I hate that word. Get your perspective, and maybe do you notice anything like a pattern with men's mental health? And I'll let you take over if that made any sense.
Yeah, with mental health. I mean, I think yeah, a lot of the stereotypes are true sometimes. I was in A&E last, so my last kind of rotation, I'm doing different rotations at the moment in the hospital, was in A&E. And yeah, you do see a lot of mental health in A&E. It's one of the most common presentations, which would sort of surprise a lot of people. So in particular, kind of suicidality, or suicide attempts, or psychosis episodes, or some kind of drug overdose. And yeah, I think you do, on the whole, in general, see it's a lot more difficult for men to, in general, to express kind of what's going on with them and, talk about their feelings in an open way. But, as you've made the point, a number of times, a lot of men are talking,
Mm.
and, you know, part of it is the responsibility for, us as doctors to provide the space and time for them to be heard. And I think the unfortunate thing with the setting of A&E is that it's chaotic, and you don't have that time. I mean, I think actually you do, as certainly as a junior doctor, which I am. I think you do have a little bit more time. We've got a mental health kind of area in A&E in our hospital, where patients who've presented to A&E will go to, and often they'll get referred to the psychiatry team who'll come and see them. But I think as that frontline doctor, you have an enormous responsibility to make sure fully that that person's heard. I think too often as clinicians we launch into kind of risk assessments almost because we're trained to be very worried about risk, in particular risk to self and risk to others, which is obviously fair enough. But I think sometimes we miss that human angle of just kind of sitting with someone and being with them and holding space for them. And that does require a little bit of time. If that person's come to A&E with, they've just had their, a suicide attempt or a drug overdose or whatever that might be, and they think they're being rushed off to the next person or sent away without being helped, that's just going to fulfill that kind of self-fulfilling prophecy within their brain that people aren't there for them. And as you probably know, that's just a really common thought cycle, isn't it? Particularly among men, but amongst anyone struggling with their mental health that has had trauma in the past or had experiences where they, maybe they have been told to just man up or get over it if they're a guy or whatever it might be. And so I think as that first responder in the acute setting, um, but also a GP and anyone on the front line, because at the end of the day, as a doctor, like we might not be trained in this as much as we should be, but fundamentally, 20% plus of what you're going to see is going to be mental health. And actually that's an underestimate because if
I
you
was, I
look at
was going to say, I presume that would be more actually, but yeah.
so I think the stats within GP land is that roughly 20% of your appointments are primarily for social and psychological reasons for
Oh,
for
okay.
the patient, which is pretty big considering
Yeah.
what medicine is. But I think if you really look at the broader impacts of mental health on a range of physical health conditions, which is huge. If you look at um, why someone is smoking 40 cigarettes a day for 40 years, there might be something going on there, and they're not able to stop despite, the lung cancer that they now have, or someone's eating patterns or uh, drinking alcohol or addiction to drugs or whatever it might be. Often these physical health conditions have enormous behavioral components, which is nearly always intrinsically linked to mental health in some way. So that's why I think that 20% is a slight kind of underestimate.
Right, okay, that's an interesting one. And yeah, again, I just feel for anyone in your space. I really do. I think you unfairly get blamed for everything when it's clear. I just don't think that's you can only use the tools provided, can't you?
Yeah, I think the public is fairly intelligent and does know that this is a system problem. But then
Yeah,
when you're in it, and you're in a hospital or you're in A&E or whatever, and someone's, they haven't been communicated properly, for several days, and they're just in a ward and they're sitting there and they're not sure what's going on, or they're in A&E and they're queuing for 8 hours. Obviously, someone's going to take the brunt of that, and normally that is frontline staff, and
yeah,
you do put up with a lot of blame and abuse that's not necessary. Well, that certainly is not your fault. And that's just what it is. It's just part of the role. And people are frustrated and people are suffering, and it's a shame that those responsible in a sense are not there on the front line taking the brunt. Because often I've got seniors that will say, okay, you have a problem with this, completely fair enough, write to your local MP. Do you know what I mean? Because
yeah,
um, or write to the hospital manager or whatever it might be. But yeah, it's I was in A&E last. I loved it. It was crazy working conditions and huge amount of corridor care and people not necessarily receiving the dignified care that they deserve. But my staff were really good and the culture was really good, and we were doing the best we could do under the conditions that we were in, and I enjoyed that side of acute medicine because you can help patients quite quickly and then turn them around and send them home, which is obviously quite satisfying. And
yeah.
there was a lot of mental health, and mental health's always been my kind of specialist area, and actually emergency medicine has a huge amount of mental health, more than I think most doctors kind of think about before going into it.
It's especially like the bloke side. Obviously, I can't speak for female. I'm not educated on female mental health at all. Is there a lot of pattern what you see time and time? I know, yes, everyone's mental health is different, whatever else, but you see everything on such a scale. Is there a lot of pattern what you see time and time again with blokes just losing it, I guess?
Mm,
Is there a lot of one? Because with me, with me, yeah, there's always relationship issues. Always see that. There is a little bit of money issues, not as
mm.
much as I expected. Relationships and kids is always a big one, but the one what I see time and time again, literally over and over again, is they've lost their sense of purpose.
Yeah, I think that is definitely a big one. I think in my kind of research that I did when I sort of did my PhD, I spent a lot of time with different community groups, and a lot of these groups were largely kind of male groups. So as I was telling you before, there was a men's shed, so a group where men would meet at a community garden and do various bits of kind of construction work, but they were all men with anywhere from moderate to severe mental illness and various other kind of psychosocial problems. And a lot of them spoke to me about the sense of meaning and purpose that came from joining a group together, and that they were missing that in their life beforehand. And I think um, loneliness is extremely common, male loneliness, and it's not that men, don't have those people in their life, but maybe they're not, you know, sharing what's really going on with them, and they don't do that until crisis point. And so kind of loneliness in that sense is really common. And I think, yeah, as you say, like a lack of meaning and purpose is definitely extremely common. And that's one of the things that um, social prescribing, i.e., connecting individuals to community groups and activities, which is what my kind of research was on, aims to deal with. It aims to deal with that problem of meaning and purpose. And I think um, medicine and the NHS in general, we're not that comfortable with that.
Hmm.
Whereas actually, I think that's surely the whole point of healthcare and mental health. We're um, trying to support people to lead meaningful and nourishing lives, aren't we?
Yeah.
And I think, unfortunately, we can lose sight of that in a bit, a little bit in healthcare, I think.
Yeah, and yeah, I'd agree with you, and I absolutely love the amount of NHS is spoke to about like sharing videos so they can for social prescribing. I think it's brilliant that more and more doctors. Well, I don't know why more and more people in the NHS. There's not just doctors there, is there? There's a whole lot more than that. Where they're using more and more like well, yeah, social prescribing of like, why don't you join that walking group or that knitting group or whatever else? And it clearly does work, doesn't it?
100%. There's significant evidence for it now that's been kind of mounting over the last 5 or 10 years. And these groups work through a number of different mechanisms. So they work through kind of biological mechanisms. So maybe a community football group reduces your um, uh, cortisol levels in your brain. They work through behavioral mechanisms. So maybe you're replacing a unhealthy habit with a healthy habit. They work through psychological mechanisms. So maybe they can improve someone's self-esteem. And they work through social mechanisms. So maybe you're reducing social isolation. So it's through a number of different mechanisms that these kind of groups work. So it's known as kind of a complex system, which is different to how a drug works, kind of, and you have drug versus placebo trials. So it's a lot more difficult to get evidence for social prescribing groups, but there is a growing evidence base, and we know these things work. So, and I think it's crucially not people being fobbed off, and I think that's crucial. We need to find a way as health professionals of encouraging these kind of groups in the community, but also that individual not feeling like we're just saying, "Oh, go for a walk, it'll get better."
Yeah.
And I think you could understand that from a citizen and a patient point of view, can't you? If you're severely mentally unwell and you've been depressed for a number of months, and a doctor kind of says to you, "Oh, why don't you just join this gardening group?" And yet, sometimes these gardening groups and these football groups and these walking groups and these knitting clubs and these swimming groups and these art groups can be life-saving for people.
Is
But
it?
I think it's up to the individual, it has to be a personalized approach.
Yeah.
If someone thinks they might benefit more from therapy or from medication or whatever, those options have to be available for people as well. But I think social prescribing, connecting people to community activities, that is a huge part of the puzzle, I think. And I think that's been diminished in recent decades, hasn't
Yeah.
it? You've seen, slashing of funding for community groups,
Yeah.
for these types of centres for people. So
Yeah, no, absolutely. Can I just ask you just one thing? I know you're not a GP, so I'm not sure whether you would see it, but one of the things what I see more so in a straight relationship is normally when the missus is dragged the fella because he's acting weird or something's wrong with him. So I'll drag him to the GP or even hospital. And then I've been in discussions, not directly, but obviously afterwards, of like, yeah, they've said, why don't you join your local walking group? Or you used to go hiking, why don't you join a hiking group and whatever else? And it's not the bloke himself who actually gets pissed off about it, it's the partner.
mm,
And then the partner, and it's really interesting. I don't see it a lot, but I see it enough to comment on it. Where it's just like, well, if you actually just, well, if you know that he used to enjoy hiking or garden, doesn't really matter what it is, and the doctor said maybe try that for a few weeks just to basically sort your head out.
mm.
If he wants to do it, rather than moaning about it, am I making sense?
Sure, yeah. I think it just depends on anyone's personality, doesn't it? And I think, maybe some people are quick to be offended by a particular suggestion because they think
Yeah,
it's not rigorous enough. But I think that's a problem with our understanding of the evidence behind, really how beneficial some of these groups can be. And social connection, remember, is a bigger risk factor for an early cause mortality than diet, smoking, exercise. So that means that the quality of your social relationships effectively predict a longer life more than these things that we more commonly associated with mortality. So things like diet, smoking, exercise. That's through a number of different mechanisms as well, and it's quite kind of complex science, but it's there's evidence for it, and we need to continue to make that argument that it's not wishy-washy stuff. This is stuff that really can, in the long term, save people's lives. People having good social connections in the community that they can talk to about what's going on with them, with their mental health, with their physical health, that chase up on them to go to an appointment, that check in with them, etc. This stuff has a massive knock-on effect on not just mental health, but physical health long term.
Yeah, no, absolutely. And yeah, again, I applaud the slow progression, but it is progression and change with it. I think is massively needed. I think what I'd really personally, what I'd like to see more is actually more blokes and their partners or whoever's in their life actually maybe just start listening on that. I've never known anybody ever to not feel better after a little walk.
Sure. I mean,
Not, not
I
ever.
agree. I
Yeah.
mean, the healing power of nature and exercise is just astounding, isn't it? And but
Yeah.
the problem is when you're feeling low, and I am, similar to you, I've had periods of prolonged depression and anxiety myself, and like when you're feeling like that, it's the last thing you want to do, isn't it? You want to sit in bed. You want to isolate yourself. You want to and yet, ironically, it's the very thing that you need to do. And I think we need to spend more time as clinicians, but anyone working in the space and working with, how we get people to form these habits,
Mm,
how we initiate action. Sometimes it's action over thought. I like that phrase, don't wait for your brain to, tell you this is right for you. Don't even think, just do it. And that,
yeah.
it's easier said than done sometimes. Um, but but yeah, we have a mounting evidence now for getting out into nature, for doing exercise, and the benefit that that has on your mental health. So how do we actually support people to do that? Well, social prescribing, i.e., kind of community groups, is one way, and it's what you do. And actually, what's so good about that is that you're kind of accountable to people. So it's not just like going for a run by yourself, and that's great. But actually, you've said to some people you're going to be at this point at this time, certain time of the week, and you kind of don't want to let them down. Is
Yeah.
part of it. And the other part of it is that your body and your mind wants that kind of social connection, so there's that extra kind of added motivation, but for a whole host of reasons, you're more likely to attend that group a lot of the time, so it's a very powerful kind of uh avenue to get people to do certain healthy behaviors, whether that's going for a walk or um playing music or doing
Mm.
some exercise or doing a creative hobby.
Yeah, well, it kind of just gives them that purpose again, doesn't
That
it?
purpose and that structure.
Yeah, because I've actually taken stick before, but I stand by it where because I'm talking as my mental health and also the mental. So with me is
Mm,
if I can keep my insomnia sorted out, actually the rest of it actually isn't too much of a problem. It still comes up and slaps me on the backside sometimes, but as if I the insomnia, if I deal with my insomnia, um, um, dropped out. I've lost where I'm going with that. But anyway, where I was going is the insomnia can deal with that. Every now and again, the depression does creep in, and there's
sure.
sometimes where I'm like, do you know what? And I say to my wife, I'm like, I'm literally just going to sit here watching Netflix, and I applaud. I think if your body's telling you to have a day off, have a day off. But there
I
is,
agree. And
however,
actually,
however,
um,
this is where I take stick. In my head, sometimes I have to make sure that me being basically a lazy slob and the wife moaning because I'm hogging the telly for that day, I have to make sure that the pity party, depression doesn't kick in on day two. I'll have
yeah,
another day, I'll have another day, I'll have another day, and then I find myself sinking in a hole.
yeah. It's a balance, isn't it, to
Yeah,
allowing yourself to feel what you should be feeling.
yeah,
And sometimes, as you say, that involves a bit of hibernation. My partner said to me, so many different animals hibernate. Why can't humans hibernate? And was kind of making the point that over the winter months, that's what a lot of people do. And it's kind
yeah.
of, maybe there's an evolutionary kind of argument for that as well. But I think, yeah, you're right. It is that delicate balance. But I think clearly you have a lot of awareness into your mental health,
Well,
and I think you kind of
therapy,
because of the work you've done,
yeah.
you know that that's going on, and you say, okay, I'm going to allow myself to have this day. I mean, I would argue allow yourself to have a couple of days sometimes as well, and don't be
Oh
so
no,
harsh.
no, don't get me wrong. Sometimes I do, but
But
I have to just be well aware that sometimes I'm like, okay,
sure,
yeah, this I'm now moving into the pity party bit.
yeah, yeah,
Get your ass off the sofa, that kind of thing. I'm not saying
yeah,
that's one size fits all, but
yeah.
I do see that pattern with the many conversations I have with
Mm.
other blokes as well, where
And
they're
I
like,
think, yeah, no,
yeah,
I think that's true, and I think. you clearly have quite a strong personality to be able to do that. Because I think when you are feeling down, to actually say, you know what, I've had a couple of days that I've taken, and that's been important, but I need to kind of in a way snap out of it, but maybe not. Maybe that's the wrong language, but maybe just do the things that I know are going to make support me, whether that's exercise or getting out into nature or going for a walk. And that can be difficult when you're in a particularly low space, which is why
It's hard. It's
we
horrible.
shouldn't have
Yeah.
to go through that by ourselves all the time. And getting the support from a partner or a friend and saying, listen, I'm in a bit of a slump. I know what I need to do. Can you help me do that? Can you just check in with me? I'm a big fan of these kind of buddying up models of behavioral change. Having just one person that bring in, whether that's a family member or a partner or a friend who can help hold you to accountable, because it's easy enough to message a friend or ask a question to someone um, to help you with this. That doesn't require a huge amount. It can require a huge amount to actually do the things that are going to support you to get better. But that initial step of just reaching out to someone and saying, "Can I have a bit of a hand with this? Can you help kind of hold me to account with this?" Personally, I find that incredibly valuable, and there's a lot of evidence for that as a model of behavioral change as well.
But you know that's why I called it Man Up, even though a lot of people hated me for it.
Mm.
Because we're not telling men to man up. There's a question mark. Even our website is manup.how. Like, do you know what the true meaning of man up is in the dictionary?
No, I don't. Go on.
Oh, this is it's in the dictionary. It's our Bible, the English language, isn't it?
Mm.
It's the term man up means to be brave enough to deal with an unpleasant or an awkward situation.
Interesting.
None of this
That's a
dragging.
much that's a much nicer definition to the one that we've maybe grown up with and come to kind of associate with man up, isn't
No, no,
it?
exactly. So that's what we try. That's what we try and try and do is just kind of take it back, kind of thing. And
Yeah, I did a video on this actually of kind of flipping that idea of man up as well. Separately, I think possibly before I was aware of your charity as well, but just the idea that actually we should associate being a man or manning up with being able to be vulnerable as well, and being able
yeah,
to own your emotions, and
yeah.
being able to communicate that. I mean, for me, that is just being a grown human being who's done a bit of work and got themselves to a position where they have some regulation over their emotions, regardless of gender, sex, whatever. I think um, that's part of being a grown up human. I think
And but
I like the idea. Yeah, go on.
yeah, I think sometimes it's a matter of taking responsibility as well, isn't it?
Sure.
Okay, right. What steps? And I do see this time and time again with men, including myself. Funny enough, I was in the BBC on an article because my gallbladder decided it hated me 2 years ago.
Gosh.
Worst pain I've ever had in my life. It's like
Yeah, it can be very painful.
oh, I was in hospital and all sorts, and my wife said it won't bright yellow. But anyway, I think where I'm going with this, but ignore the mental health stuff at the moment. I think it was during the strikes with the NHS strike, but I was really, really ill. I was thrown up bile and whatever else. And my
Mm,
wife was like, Dan, go, you need to go to the doctor. So I'm like, it'll be fine, I'll fix it. But I got in my head that I will fix it
mm,
because I didn't want to be a burden. And I see that time and time again with a lot of other blokes is I do believe a lot of men are reaching out and talking, but not quite at the stage I would personally like because they want to fix it themselves
yeah.
first.
I agree, and you see that in the evidence, across the vast majority of physical health conditions. Even
Yeah.
men have worse outcome than women, and the evidence suggests that that's behavioural, and part of it is men seeking help a lot later. So, their cancer's a lot bigger by the time they
Oh
have
yeah, yeah,
treatment.
absolutely. Right.
So,
My,
and
my
that,
yeah, my wife dragged me to the doctor and he was like, you need to go to hospital now because if you don't, you're like days away or hours away from getting sepsis.
gosh,
I was like, yeah, I was in there for a week and all sorts.
oh bless you, God.
Yeah, no, but that's the thing. It was my fault. It got that bad
Mm,
and all sorts. But even though I did have my gallbladder taken out, funny enough, only a few months ago. Literally, no, it took like 2, 3 months. No, was it last year? Like within 6 months ago, I had to wait a year while they sorted
mm.
it for now. And
Wow.
then I think my doctor dropped it because they when they took it out because a gallstone went flapping around with my liver or something like that. I still blame them to this day. But anyway, it's just one of those things. Yeah.
Have you recovered okay since then now?
Absolutely fine, absolutely fine. But this is one of those things going off track. It's funny enough, when I had my infection, I was in the hospital, drips and all. That was brutal. Throwing up bile, and it was the worst pain I've ever had in my life.
God.
But anyway, managed to get out of all of that, and I was on the waiting list for like a year, and I've heard some horror stories for how much pain people are in for a year. Do you know what? I was absolutely fine. If it ever
Mm,
niggled, raw apple cider vinegar for me personally just worked, it
mm,
just stops it. But
mm,
funny enough, when I got the letter or phone call saying, "Oh, down in 2 weeks we've got a cancellation. Do you want it?" It's weird because then my brain accepted that I was going to have it out in 2 weeks.
mm.
Gallbladder decided it wanted to cause mayhem for 2 weeks. It's
It's
literally
interesting that, isn't it? I
really
don't know if you've
weird.
ever done any long kind of runs or races, and that seems to be a thing, doesn't it?
Yeah,
The pain always kicks in, right before the end, or if you've been, needing to go to the toilet and holding it in,
yeah,
just before just before you get there, suddenly it's
no, exactly. It's crazy how the brain works, isn't it?
yeah.
It really is. But so just before George, because I know it's your day off, you are a doctor. I don't want to hold up all of your day. So just before George close, you obviously see a lot of crap. And like, how do you deal with your mental health, and how do you keep yourself from not getting? How do you prevent yourself from getting the crazes and taking all that in? Like, how do you? Because you must see some horrible stuff, especially A&E. That's
Yeah, you do. You do see a lot of horrible stuff. It helps having kind of supportive teams that you can debrief with sometimes. You do become a little bit I don't think desensitized is the right word because I still feel everything very strongly, and I like feeling things very strongly because I think it's a good sign for your kind of empathy levels. I don't like the argument that you often hear within medicine that you have to numb yourself to things and you have to become desensitized to things. I think if you feel able to have the capacity to hold those things and still feel them, but still function. For me, that's the healthiest thing. But I have a big support network outside of medicine. Most of my friends aren't doctors. Very supportive partner. And I do, a lot of things that support myself, whether that's kind of sports or getting out into nature or seeing friends. I think I've kind of develops a lot of things that kind of help me. And then I also think, you do the human being, I think, becomes very good at dealing with these things when you've done them for a few years. I still don't think that means you have to numb yourself. It just means your capacity to see what might look like very chaotic and crazy things on a regular basis is um, increases over time, should we say?
yeah. I think it's a good answer, and I'm so glad you said about the desensitized thing. I misquoted, but the one thing what I started to realize, I do have weekly therapy,
Mm.
and also mostly because there's bloody charity, if I'm honest with you, because I really started to. It started to tip me over the edge, the amount of suicides. Well, it's not the suicides. It's weird. It's not hearing about the suicides that bounces off me now. Some of them every now and again, I'll go for a walk or something like that. It's because I tend to speak to the families,
Mm.
and after a while that does get to you. But anyway, so sorry. Fast forward, I started to realize like I'm able to just brush off is the wrong word, but maybe the therapy or just the way of processing it doesn't cause me that much issues
Sure.
anymore.
No, I think I'm similar. And I've always been that way with mental health stuff. I've kind of felt like I have quite a big um, capacity um, to deal with that kind of stuff as a clinician and kind of hold space for it. And I in a weird way, kind of enjoy it because I think I can. That's where my strengths are.
Yeah.
Um, but it obviously impacts you. And I think if it didn't impact you at all, um, then there's a risk that you end up not doing your job properly. Um, and there's a risk that you've lost a bit of that kind
Mm,
of empathy. And you do see that in um, in a lot of health professionals, unfortunately. Whether or not they were ever able to support with that side of things, or whether it's just a numbing over time, I don't know. Uh, it's probably both. Um,
I do see a lot of burnout, especially paramedics, actually. I see
100%.
so much burnout, and it's something what I've said before. I think it's because you guys care more about other people than you probably do yourselves.
Mm. I think that's part of it, and I think it's also yeah, it's a problem with the culture within the NHS, and it's also a problem with the working conditions.
Mm.
It's both. I think there's not a great culture on taking breaks and um, taking sick leave when you're actually sick, and um, there's you know not the greatest working conditions in the NHS at the moment. So I think a combination of these things means burnout is extremely common, and you're seeing more and more doctors working less than full time, or leaving for Australia or New Zealand or Canada. Um, that's the reality at the moment, unfortunately.
Yeah. Well, hopefully, slowly it will change. I'm just trying to put it on some sort of positive.
Hopefully, yeah,
Yeah,
hopefully. It's got to. It's got to.
well, it's got to. It really has. So just before we draw to that, this is the last question because I really want you to have your day off as well. I probably know what you're going to say, but if a bloke's watching this, just feeling it doesn't need to be about mental health. I think there's way too much focus on the talking about the mental health rather than sometimes you're just having a shit day.
Mm.
What would you say for them to do? I know it's a hard question.
I think on the whole, I would say don't try not to deal with that on your own all the time.
Yeah.
We're not an island, and it's not manly or brave or intelligent actually to suffer in silence, in my opinion. It's very understandable and noble to a degree to not want to burden people, quote unquote, but most of the time with most good relationships in your life, you're not a burden to them. People want to help you. Think about it when a friend's come to you and they've needed some help. You want to help them, don't you? You often feel good about helping them. So it's the opposite of burdening someone when you're talking about what's going on. And we don't have to call it mental health. It's just, the health of the mind and your
Mm.
emotional well-being and just how you're feeling day to day. I think don't suffer in silence. And there are varying degrees of that. You don't have to tell everything that's going on with you to someone at a certain point in time. You could try with, little things and then saying, that's probably all I'm comfortable with for now, but, thanks for being that space for me. Or you can, I'm biased because I did a lot of my research on this, but you could join, more community groups and some sort of activity in the community that might be kind of beneficial for you. And often those activities don't involve talking about your feelings or your mental health, but are therapeutic.
Mm. That was a good answer. A great answer considering you're a doctor as well. So thank you very much. There we go. Let me hit the unrecord